Hello, today I'm going to talk about serious asthma events with fluticasone plus salmeterol versus fluticasone alone. Definition: asthma is a common long-term inflammatory disease of the airways of the lungs. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and bronchospasm. Symptoms include episodes of wheezing, coughing, chest tightness, and shortness of breath.
Air, or oxygen, is taken in through the mouth and nose. It then passes through the trachea to the bronchi. Asthma is a condition where the airways become irritated and inflamed. The bronchi are large tubes which are found in the lungs. Air flows through these tubes. The bronchi branch and narrow into tubes called bronchioles. The bronchioles continue to branch and end with tiny air sacs called alveoli. In healthy lungs, oxygen is taken into the body through the bronchi and passes into the blood via the alveoli. If you have an asthma attack, you may start wheezing. Your chest may feel tight and you may be breathless.
Application in medicine. Asthma is the result of chronic inflammation of the conductive zone of the airways, most especially the bronchi and the bronchioles, which subsequently results in increased contractibility of the surrounded smooth muscles. Typically, changes in the airways include an increase in eosinophils and thickening of the lamina reticularis. Chronically, the airways smooth muscle may increase in size along with an increase in the numbers of mucous glands, and also other cell types involved include lymphocytes T, macrophages, and neutrophils.
"15-year-old Chris is having a severe asthma attack. His immune system has made what could be a fatal mistake and is shutting down his airways. Without help from the medical team, Chris's body may shut down completely.
You're not going to die. You're not going to die. You'll be okay.
The breathing tubes in Chris's chest are squeezing tightly shut and filling with sticky mucus, blocking his vital oxygen supply. If he's not treated soon, he will die."
This is a really life-threatening episode of asthma. Asthma is pretty common in our community, and most of the time it's not this life-threatening, but this one is quite serious.
Chris's allergic reaction has tricked his immune system into shutting down his airways, blocking vital oxygen to the rest of his body.
Causes. Many environmental factors have been associated with asthma development and exacerbation, including allergens, air pollution, and other environmental chemicals. Beta blocker medications such as propranolol can trigger asthma, and also IECA and aspirin. The strongest risk factor for developing asthma is a historic of atopic disease, such as dermatitis, rhinitis, and asthma.
That was Patricia. She's here today along with Dr. Jeff Hales, Chief of the Division of Pulmonary Care Medicine at Virginia Hospital. Thank you both for joining us today.
Welcome.
Thank you. Glad to be here. And what I love about this is so many people suffer from asthma, breathing difficulties, and we've traditionally treated them with certain medications, trying to keep symptoms under control. But this is groundbreaking what you're doing.
Yes, so the technique is called bronchial thermoplasty. It's a procedure-based technique for asthma, severe asthmatics, patients that have the disease and remain symptomatic despite using daily medications.
So these are patients who their airways constantly are closing up on them. Patricia, you know this feeling. You feel like you're going to die.
I know it well.
Can't get air, wheezing, and you're putting heat into that bronchial airway, right, with radio frequency waves. What is that exactly doing to the airway?
So this gentle heat therapy causes regression of the smooth muscle, and that smooth muscle is what constricts in an asthma attack. What we're seeing is a video showing a small tube being placed through the windpipe into the lower airways. A catheter is being advanced, and the basket is touching the walls of the airway, applying the gentle heat therapy, which leads to the regression of the airway muscle. And once again, that muscle is what constricts the airways during an asthma attack.
And typically, how many treatments do you do?
It's a series of 3 sessions, each scheduled about 3 weeks apart.
Salmeterol and Fluticasone. Salmeterol is responsible for a stimulation of beta-2 receptors in the lung that causes relaxation of bronchial smooth muscle, thus producing bronchodilation therapy, increasing bronchial air flow. This can inhibit bronchoconstriction produced by histamine, methacholine, and exercise. Fluticasone is a corticosteroid that blocks allergic response to allergens late phase, inhibit the release of mediators of inflammation, attenuate mucus secretion, reducing bronchial hyperresponsiveness and asthma exacerbations. Neither of these 2 drugs are used in acute attacks because its effects are slow to be clinically detectable.
Feel like you're in a pool of water, can't breathe. When you try to breathe, it don't work.
You feel like you wish you could still be playing outside.
People feel like they've got someone squeezing their chest, like an elephant is sitting on them, where they can't get air in, they can't get air out.
You can have a good day or a bad day, whatever, it just hits you. You can't have any warning.
Try to put that pillow on your face, push it. It's horrible. You feel desperate because you can breathe.
85% of the time I have asthma attacks is because of the air. It's what I'm breathing that's making me sick. I know it.
It's essentially ashes in an ashtray. You know, we're breathing these particles down into our bodies. 11 Americans die every day from an asthma attack, and that's something that we can prevent.
Conclusion. In a study of 11.69 patients, 34 patients were in the Fluticasone Salmeterol group and 33 patients only in the Fluticasone group. The patients that received combination of Salmeterol and Fluticasone asthma exacerbation events did not have a significantly high risk than in the Fluticasone group.
Asthma is a respiratory condition that prevents normal airflow from outside to the alveoli of the lungs. During normal respiration, when we inhale, air goes in through the nose to the upper airways. Then it moves through the trachea or windpipe. The trachea branches into 2 large tubes called bronchi. Then inside the lungs, bronchi branch into smaller air pipes called bronchioli. Finally, from bronchioli, air moves inside tiny air sacs, called alveoli, so that gas exchange can take place. Oxygen moves inside the blood, while some carbon dioxide diffuses in the opposite direction from the blood into the alveoli. In people with asthma, a flow of air is restricted due to narrowing of bronchi and bronchioles. Bronchospasm due to asthma is caused by 3 factors: constriction of smooth muscles around bronchi and bronchioles, swelling of cells in airways due to chronic inflammation, production of extra mucus due to inflammation and asthma triggers. These 3 factors cause the airways of asthmatics to narrow and swell. To some degrees, these factors can be present in people with asthma all the time. During an asthma attack, the degree of bronchoconstriction is even higher. As a result, asthmatics suffer from coughing, wheezing, whistling or rattling sounds in the chest tightness, and difficulty breathing.
Thank you for listening.